My name is Mark Brandt, and I'm a urologist at Presence Health. I've been here for 20 years. I went to medical school at University of Michigan in Ann Arbor, and I did my general surgery training in Boston before I went to Cincinnati and did my urology training at the University of Cincinnati. When I graduated from my residency program, I came to Chicago, and I've been practicing here ever since. Urology is a very broad specialty because we deal with a lot of different disease states in men and women. We deal with stones, tumors, voiding dysfunction, erectile and sexual issues. All these are common issues in urology. I would actually say that after 20 years in practice, most of the things that I do are not things that I learned how to do 20 years ago. These are all new techniques that have been developed within the last 20 years. So these were technologies and procedures that I introduced to my practice by going to coursework and practicing with other doctors around the world and around the country to bring those techniques here to Chicago. One of the things that I think that I'm most interested in is in robotic surgery and treatment of various cancers. Ever since robotic surgery was developed and initiated, I've been one of the people that's been on the north side of Chicago doing a large amount of robotic surgery at this institution. I like to do complex cases, kidney cases, and the more routine thing, which would be prostate cancer robotic surgery. Robotic surgery is a way of minimally invasive surgery operating on various parts of the body without making a big incision. The robot is a very advanced instrument with great optics, 3D optics, and allows us to see much better, do a more meticulous and careful job, and helps the patients recover more quickly with a lot less bleeding and side effects. In addition to the standard procedures that most urologists would do, we also have a very active practice of in-office surgery, which I think is a big advantage for patients. You can turn around quicker and get home and back to your activities. One of the advantages of being in the office is that it's a less intimidating environment, and the recovery is a little bit quicker with some of the techniques that we use. Rather than having a full anesthetic, you're given a twilight, a more relaxing technique such as one would have with a colonoscopy. During a procedure like that, we could actually take care of someone's urinating troubles or prostate issues fairly permanently in a procedure that takes maybe 20 or 30 minutes. This practice has been in existence for almost 30 years, and the way that we learned how to do it in the past is the way that we still do it now. We don't compromise our values. We put the patient first. We take the time and care and attention necessary to give every patient that comes in to see us the attention that they need. And I don't like anyone to leave my office without their questions fully answered. Patients should come to our practice because they want the best, because they want surgeons and staff that know how to do the latest techniques, that really care about what they're doing, and get up every day excited to come to the office and take care of the people we see.